of drug toxicity. Report any problems to the provider. Your ongoing assessment will also include evaluating that the medication is having the desired effect, such as pain control. Be sure to watch for potential complications in clients who receive repeated intramuscular injections. These include nerve damage, infection, or abscess formation at the site, and damage to blood vessels. Frequent blood glucose testing is essential for treating diabetes effectively. For ongoing monitoring of blood glucose, skin puncture for capillary blood is a technique that is easy to perform, plus it is less painful than venipuncture. Clients also use this procedure for home glucose monitoring. Today's competitive medical equipment market offers a variety of blood glucose meters that are simple to use, accurate, and widely available. Each device has its own specific directions for use, and as part of discharge planning or home care, you will review the use of the particular equipment with your client. You'll observe your clients performing skin punctures and using the equipment to make sure they are prepared to monitor their blood glucose levels accurately. For precise readings, some form of calibration or verification is often required. The procedure will vary with the specific glucose meter, so you'll be sure to review and follow the manufacturer's instructions carefully. For adults and older children, the fingertips are the most common site for skin puncture. It is best to use the lateral aspect of the fingertip because punctures in the pads of the fingertips can damage nerve endings. Punctures in that area can also be more painful, for example, if the client uses a keyboard regularly. The fingertips can also be calloused, for example, if the client plays guitar. The earlobe is another good choice, especially if the client's hands are edematous or the client is in shock. And some of the newer blood glucose meters are designed for obtaining blood from the arms and legs. If you are monitoring capillary blood glucose for a hospitalized client, you'll check the provider's orders for the frequency and type of testing to be done. You'll explain the procedure and its purpose to the client and family. If you'll be administering insulin based on the results of glucose testing, you'll explain this procedure to the client and family as well. You'll follow the sliding scale the provider has specified, giving a specific dose of regular insulin based on the client's blood glucose reading. A typical routine would be testing 30 minutes before each meal and at bedtime. Now let's go ahead and demonstrate determining a capillary blood glucose level using a glucose meter. We'll assume the nurse has checked the provider's orders, verify the client's identity, explain the procedure to the client, and review the institution's protocols for this procedure, as well as the manufacturer's instructions for using the device. First, the nurse assembles her equipment. She will need the glucose meter, a glucose reagent strip, an antiseptic pad, clean gloves, a sterile lancet, a lancet injector, and cotton balls. The nurse washes her hands and puts on gloves. To prepare the selected fingertip, she places it in a dependent position and massages the finger gently toward the site to increase blood flow to the area. Next, she cleanses the site according to the institution's protocols and allows the site to dry completely. Alcohol in particular can affect the results if it has not fully dried. While using her non-dominant hand to apply gentle pressure proximal to the site, the nurse uses her dominant hand to puncture the skin at a 90-degree angle with the lancet injector. If a lancet injector is not available, she would give the site a quick stab at a 90-degree angle with a lancet. She then applies the blood to the reagent strip. She asks the client to keep pressure on the puncture site with a cotton ball until it no longer bleeds. The nurse then follows the manufacturer's directions for how long to expose the strip to the blood, whether or not to wipe the strip, and then how to insert the strip and obtain the reading. After obtaining the reading, you'll remove your gloves and dispose of them and other materials in the proper receptacle. Make sure the client is comfortable, then wash your hands. Document the reading, how the client tolerated the procedure, any other concerns or observations, and any insulin administered based on the result in the client's record. You'll also be aware of previous glucose testing results for the client and compare the current result with them, taking into consideration any treatments and medications that might influence glucose levels. Also be sure to assess the puncture site on your next visit to the client's room. If your client is newly diagnosed with diabetes, you'll assess his readiness to perform blood glucose testing independently. Explaining the process and reviewing the steps with each test will help him prepare for self-testing. Gradually, you'll transition the procedure over to him, making sure he understands that successfully treating diabetes depends on his frequent and accurate measurement of his blood glucose levels. Medications injected into the subcutaneous or fatty tissues just beneath the dermis move into the bloodstream faster than they would if given by mouth, but slower than they would if injected into muscle or into a vein. This is because subcutaneous tissue contains fewer and smaller blood vessels, making this an appropriate route for slow systemic absorption of small amounts of non-irritating aqueous solutions, such as insulin and heparin. The subcutaneous route is appropriate for injecting up to 1 milliliter of fluid. The medication must be water-soluble and strong enough to be effective, but it cannot be harmful to surrounding tissues. Into which areas is it safe to administer a subcutaneous injection? Most sites are safe, unless they cover a bony prominence, have large blood vessels, or are inflamed, excoriated, tender, or edematous. Subcutaneous injection sites should also be free of scar tissue, and they should not be on a limb that is paralyzed or inactive due to neurological impairment or joint disease. Common subcutaneous injection sites are the outer aspects of the upper arms and the abdomen, from just below the costal margins to the iliac crests. Other safe sites are the anterior aspect of the thighs, the scapular areas, and the upper ventrodorsal gluteal areas. For clients who receive subcutaneous injections regularly, it is important to rotate injection sites. Clients who have diabetes should choose one anatomic area and rotate injections within that site. This is because insulin is absorbed at different rates from different parts of the body, so rotating among areas could cause fluctuations in glycemic control. For example, insulin is absorbed fastest from the abdomen and the arms and slowest from the thighs and buttocks. It helps some clients to use an injection rotation diagram. They check off the specific site within the area when they self-inject and note the date and time as a reminder to move to the next site within that area for the next injection. Orderly rotation of injection sites minimizes tissue damage, keeps the medication absorption rate consistent, reduces discomfort, and prevents lipodystrophy, which is the wasting of subcutaneous fat. Next, you'll select the needle size and length based on the client's weight, the amount of subcutaneous tissue available at the selected site, and the angle of injection you'll use. A 1 or 2 milliliter syringe and an insulin syringe are the typical choices for subcutaneous injections. A good way to determine the insertion angle is to pinch the client's tissue at the site. If you pinch 1 inch of tissue, that's 2.5 centimeters, insert the usual 1/2 or 5/8 inch needle at a 45-degree angle. If you grasp 2 inches of tissue, use a 90-degree angle with a 3/8 to 5/8 inch needle. A 25 or 27 gauge needle is appropriate, although 30 gauge, 5/16 inch needles are available on 30, 50, and 100 unit insulin syringes. Most clients prefer the shorter, thinner needles, as the injections are less painful and there is less risk of injecting the drug into a muscle. For obese clients, pinch the tissue and then select a needle long enough to insert through the epidermis and the dermis and into the fatty tissue. You might need a 1-inch needle injected at a 90-degree angle. The upper abdomen is the best injection site for very thin, emaciated clients or older clients who have minimal subcutaneous tissue. For these clients, use a 5/8 inch needle inserted at a 45-degree angle.